In this video, we're going to be talking specifically about hip pain and what cause for hip pain is, how to release it and take that pain away, but also to strengthen this new alignment so we can prevent the body from falling back out of alignment, causing more additional hip pain.
Cool. So Quinn, I'm going to get you to stand up so we can just talk about what ultimately causes hip pain, because it really comes down to proper alignment and space around the joint. So show us in your pelvis where your hip joints are first of all. So we're like a building. We want to have everything positioned so there's proper space. The head of the femur is coated in cartilage, and there should be space between the cartilage and the pelvis. When we shift out of alignment, which everybody pretty much does, we tend to have our weight on one side and then the other side will splay, or maybe both legs are splaying, standing like a duck. All of these different alignment creates a shifting of the actual hip joint. If that becomes your chronic way of standing, then you end up wearing that cartilage away, which creates inflammation, scar tissue inside, and that takes that space away. So we end up losing range of motion and we have pain in the hip joint. So one really good postural exercise you can do is simply, I'm going to give Quinn the block here. You can use a hardcover book. We're going to put
or the towel.
Or the
even.
towel.
Yep.
And we're going to put that just above the knees. This is really going to help to align the kneecap over the second toe. So we ultimately want to have our feet under the hip joints. We want to have the knees slightly bent, kneecap over the second toe, and then we want to squeeze the block as we connect to that rooting action that we talk so much about, that squeezing of the anus. And again, it's not a hard contraction. It's like stopping a bowel movement, that action. There will be action of the glutes involved. This will allow us to bring our center of gravity back onto our heels where they should be. Otherwise, we end up tipping too far forward, and that also causes more of that rotation, which throws the hips out of alignment. So if you can do this every day to cement proper alignment, do this in front of the mirror, take 10 full breaths to really feel that, and then throughout the day, this is how you want to be standing, because ultimately this is where our cells should be in proper alignment. Now, as you'll be starting this, you won't be in proper alignment. So what we're going to do now is show you a couple of things that you can also do with either a towel, a hardcover book, or the preferred tool, the block.
All right. So this is the hip flexor position, a very common position with block therapy, especially before we start working into other areas of the legs. So I'm going to be showing you this with the towel to start here.
Yeah.
So here's the rolled up towel. Just below this bone here is your ASIS. So this is your ASIS bone. We want to have the towel located just below that bone. And now to get into this position, you're going to have the towel more horizontal to your mat, and then slowly approach the towel or whatever prop you're using. As you do this, bend your opposite leg, so your left leg to its side. And then we're going to start up on the elbows here, and we're just going to let your body weight and gravity sink into the prop, and that's going to start the fascia decompression.
And then, of course, we want to stay in each position for a minimum of 3 minutes, because that's really the key here. It's time that we need to create a melting effect. We want to also combine proper diaphragmatic breathing, which we've shared in many videos. And then once you start sinking in, you want to search for pain. Now, if you've never done this before, the towel is going to give you the sense. But Quinn, if you want to shift now so you can show people using the proper tool what that looks like, this is definitely going to give you more of that sensation of pain. And as you continue to do the work and melt through those layers of adhesions, you're going to crave that deeper connection that the block will actually give you. And then you can very slowly move the leg, searching for the pain. Fascia is chaotic in how it winds and grips and holds us. And because we sit so much of our day, whether in front of a computer or whatever we're doing, we compress in this area and we twist. So there's a whole lot of adhesion. We want to create as much length in the front of the pelvis as possible so that we can go back to that postural work and really realign those hips properly. So of course you want to do this on both sides. And a minimum of 3 minutes in each position as you connect to the breath. And we always share, as long as you're breathing, you're feeding and healing your cells. As long as you're breathing in a relaxed way, I should say. If anything hurts so much that it takes that relaxed breath away, that's your body letting you know it's too deep and intense. And we share that in every position that we do in block therapy.
And the hip flexors are so compressed and so dense, especially from sitting all day. So I find you really do need a tool that's harder to get in and actually create that release. And then once you spent about 3 minutes here, let's place the hands under the shoulders and always make sure you exhale as you come up and out of any of these positions.
And then just one other thing to notice, because the sit bones are also part of the pelvic alignment, which affects your hip joints. So if you're sitting in a chair or on the floor, connect to those sit bones. You can even toggle back and forth. And ultimately, you want to feel balanced on both of those bones. If you really pay attention, you'll probably feel like you've got more pressure on one than the other. So the goal is symmetry. So balance and symmetry as we release the adhesions will help you create better alignment in that joint space and decrease inflammation and pain.
Yeah, and I would do the position first and then do the strengthening exercise after, because we released the fascia, now we want to strengthen it and bring that balance and symmetry back. So that is everything for this video. Thank you so much for watching. If you liked it, give it a thumbs up. If you have any questions or comments, just leave those below, and then subscribe to our channel, hit the bell if you want to be notified every time we upload a new video, and we'll see you next time.